Welcome to Addictopydia, where I break down recovery truths and help you support the people you love, with compassion, clarity, and real facts. Today's topic is a big one. How can you talk to your loved one about medication-assisted treatment, or MAT, without judgment, conflict, or confusion? Let's dive in together. First, let's get clear about what MAT actually is. Medication-assisted treatment means using FDA-approved medications, along with therapy and counseling to treat substance use disorders, especially when it comes to opioids or alcohol. For opioid addiction, there are three main medications. Methadone, which is a long-acting opioid that helps reduce withdrawal symptoms. Buprenorphine, which you might know as Suboxone or Subutex, helps cut cravings but doesn't give a full high. And naltrexone, also called Vivitrol, actually blocks opioid effects completely. If your loved one struggles with alcohol, the medications look a little different. There's naltrexone, acamprosate, and disulfiram. Here's the thing, MAT doesn't replace recovery, it supports it. It's kind of like using insulin for diabetes or an inhaler for asthma. These medications help stabilize the body while your loved one works on healing their mind and life. But here's the tough part. Not everyone is open to MAT. Sometimes people think MAT is just trading one drug for another. There's a lot of shame, and some folks see it as a crutch. Maybe they've heard scary stories or tried MAT before and had a relapse. Some treatment programs or 12-step groups even add to the stigma. So when you bring it up, try to understand what your loved one believes and why. My goal isn't to argue or force anyone to accept MAT. I'm just hoping to plant a seed and open a door. So how do you actually start the conversation? Here's a simple framework I use. First, pick the right time. Don't have this talk when your loved one is high, angry, or in crisis. Wait for a calm moment. Maybe after they've talked about wanting help or struggling to stay clean. Second, use I statements. Start with how you feel, not blaming or accusing. For example, I've been learning more about addiction and I found something that might help you feel better. Third, share, don't push. Mention what you've read or watched. Try something like, "There's this thing called medication-assisted treatment. It's helped a lot of people get back on their feet. Would you be open to hearing about it?" And finally, be patient. If they're not ready, don't push. Just let them know you're there, no matter what path they choose. Backing up your words with real facts can make a world of difference. People on MAT are more likely to stay in recovery, and less likely to die from overdose. MAT does not get you high when you take it as prescribed. In fact, it's used in jails, hospitals, and recognized by the US government as the gold standard of care. I've seen it help people get jobs, reconnect with family, and build stable lives. If your loved one wants to learn more, point them to trusted sources like samhsa.gov, or the National Institute on Drug Abuse. There are also incredible MAT success stories on YouTube and Reddit. Real people, real journeys. Here's the most important part. Offer support, but don't put pressure on their decision. You can say, "You've been trying so hard. I just want you to feel better, and have every tool available." Or, "Whether you choose MAT or another path, I'll support you. I just wanted you to know this is an option." If they're interested, you can offer to go to a doctor or clinic with them, help look up providers, or even watch a video about someone who found success with MAT. Remember, your job is to be a bridge, not a bulldozer. MAT isn't for everyone, but for some people, it's absolutely life-saving. You don't have to convince your loved one today. Every loving, respectful conversation builds trust. Keep learning, keep listening, and remember, change takes time. If you found this video helpful, please like, subscribe, and share. You never know who needs to hear this. I'm glad you're here, and I hope you'll keep reaching out, asking questions, and supporting the people you care about. I'm Rico, and this is Addictopydia, where healing starts with understanding. Stay hopeful, stay informed, and stay connected. Resources are below, you're not alone.